Welcome to another FitOmics podcast. This is going to be a short format where we talk about a specific study. And in this particular study is a pretty new one that is from Lawson et al., which I believe came out of Dr. Brad Schoenfeld's lab, where they looked at the calf raise. And they looked at either completing it through a full range of motion to what they call momentary failure, and we'll define that here shortly, versus continuing that set beyond failure in a stretch position through lengthened partials. So lengthened partials, man, they've gotten a lot of attention.
Yeah, there's certainly been more investigations on this topic in the last, I guess, 5 years than years prior. So it's an intriguing area. It's popular right now.
Yeah, and it seems the directionality of evidence is pointing in favor of doing lengthened partials. And so maybe a good quick description of that could be helpful for the audience of what a lengthened partial is versus full range of motion versus maybe shortened partial. So you were just giving, before we hit record here, a good explanation of that with the bicep curl, right? Do you mind providing that?
Yeah. So it sounds like a fancy term, I suppose, like lengthened partials, but really any given movement is going to have a range of motion, right? And what we're really getting at here is if we take the full range of motion apart into literal parts, partials, the muscle, the target muscle, the prime mover, the muscle that is generating the torque to change the joint angle is in a more or less lengthened position. So a biceps curl is a simple example where if the elbow is extended and you start to flex the elbow, then halfway up, so from full extension to halfway up, that would be a lengthened partial, right?
Mm-hmm.
In this definition. And then a say partial range of motion, call it a shortened partial if you want, from halfway up, so the elbow's at, let's say, 90 degrees to fully contracted, then that would be more of a shortened position. And so the theme of the research so far, I suppose there's about 10 studies now that have compared in different ways the effects of either lengthened partial to full range of motion or a partial, shortened partial. We'll just use that nomenclature. And the theme of the literature right now is that the lengthened partials, by comparison to the shortened partials, we'll say, do tend to promote relatively more growth across 2 or 3 months. And in some of that research, the lengthened partials actually tend to promote the same amount of muscle growth as the full range of motion condition. And some of those studies are in within individuals. So one limb, in this case, one arm would do lengthened partial alone, and then the other arm might do full range of motion. And when you use ultrasound, or even some of those are MRI based measurements, it does seem that one can gain a similar or perhaps even greater amount of muscle in 2 or 3 weeks or months rather, doing lengthened partials as even full range of motion. So it seems to be at least as good in those studies as full range of motion for muscle growth. So we're not saying that we think that everyone should do lengthened partials to grow the most muscle. That's just where the current literature stands. And so, one thing I liked about this study is it combined both. So full range of motion, and it was the first study, to my knowledge, and the authors, as noted in the paper, that looked at if you take a set to momentary failure using full range of motion on a calf raise, and then continue that set. So beyond full range of motion failure, if you continue the set by doing lengthened partials to volitional failure, so just the voluntary stoppage of a set, they compared that within individuals to just full range of motion to momentary failure. So we'll get into what they found. But Dan, did you have anything to add to that?
I think maybe a potential point worth discussing is, and there's not a lot of evidence mechanistically on why lengthened partials might be favorable for a greater hypertrophy outcome. But kind of briefly, there's mechanical tension would be the primary driver for muscle growth, right? And of course, some other potential mechanisms that have been proposed is like quote unquote metabolic stress, muscle damage, which doesn't seem to be a much of a contributor or any at all for muscle growth. So I guess with the lengthened partials, what might be unique about that in the stimulus that it's providing? Is it just, would you say, a greater amount of time under tension, or the mechanical tension that's experienced by the muscle fibers, you know? And then kind of what's the role of maybe active versus passive tension in a lengthened partial position that might be making it a unique uh, stimulus for hypertrophy?
Yeah, yeah. To your point, the literature on that, I'm actually not aware of a study that's actually teased apart what's going on at the molecular level. But yeah, tension, I don't think really anyone's debating that much anymore, that that's like the key signal, just the pulling forces and that are experienced by the fibers. So at the individual fiber level, that seems to be the key signal to promote increases in muscle protein synthesis and eventually changes in size. So yeah, you have active and passive tension. So when I'm voluntarily recruiting the muscle to contract, that's active tension. So there's tension being generated in the muscles from voluntary recruitment. But then placing a muscle in a stretched position is exposing it to tension, right?
Mm-hmm.
Some amount of passive tension. And zooming in a little bit, the focal adhesion kinases, for example, and then you have like J and K. We took a look at some of this at Auburn, and it was kind of difficult to measure some of these, but there are actual, some people call them costomeres, but there are proteins on the sarcolemma that seem to sense tension and uh, become phosphorylated, that eventually there's a cascade of signals that upregulate the activity of mTOR, which is kind of that central, molecular hub of proteins. It's a complex that eventually stimulates or initiates the translation of messenger RNA, and that's protein synthesis. So there's that tension signal from the membrane into the cell, into the mTOR complex, which eventually stimulates the translation of messenger RNA. And so I guess in some sense, those focal adhesion kinases, those costamere proteins, it's not like they understand, if you will, the difference between tension generated actively or passively. And so I think, that's playing a role here, probably.
Uh-huh.
And then beyond that, I don't think we want to go much deeper because it would just be a little hand wavy. That's
Uh-huh.
probably what's happening here. I think if you look at the spatial orientation of myosin and actin proteins, within the Z discs and the individual myofibrils, maybe you get better overlap. If we're in a shortened position, right, there might not be as good of an overlap in certain regions of the myofibrils,
Uh-huh.
right? I liken it to sort of Velcro strips. This is not how it actually works, but like if I have two pieces of Velcro and the edges are exposed, and then I'm trying to join them together, well, these two portions aren't getting direct interaction, and so there's not as much tension. Whereas if we just stretch the muscle a little bit more, maybe you get more overlap, and you can generate more active tension from a lengthened position, throughout the
Right.
entire myofibril pool. So, the tension piece is probably the most intriguing here.
Yeah. So kind of talking about like the length tension relationship is that there's likely an optimal range at which there's the most overlap between actin and myosin to result in a pulling force on the muscle tissue. And then potentially, even with the lengthened position, that the passive tension that could also start to increase, maybe exponentially up into a point where tension is still fairly or really high on the muscle tissue that can result in signaling cascades for hypertrophy. I think that was a good look behind the curtain, a little bit of a dive there. Some other kind of maybe key concepts and some background on this topic for this study in particular would be defining failure. And so in this study, they had momentary failure as well as volitional failure. And so the way that they define it is essentially momentary failure occurs when your muscle really cannot complete another rep with proper form. So when you try to contract the muscle and move the weight, nothing moves. Whereas volitional failure is really essentially when you are deciding that you can't do anymore and you quit. And it's possible that volitional failure could occur before true muscular failure occurs, right? So a metaphor for this could be like a car that begins to sputter and it stops because it's out of gas. And that could be momentary failure versus you're watching your fuel gauge start to go down and then the gas light comes on and you stop because, oh, I need to get fuel, right? That could be kind of a metaphor to explain that.
Mm-hmm.
And so we've defined partial reps. We've gone over the lengthened versus shortened muscle positions. We've discussed why stretch partials or lengthened partials might work a little bit better than maybe perhaps just full reps or training in the shortened position. Some other things in this study was perhaps maybe the statistical analysis that they use. So overwhelmingly within a lot of research, especially exercise sciences, there's the frequentist approach where we have p-values to determine statistical significance versus in this paper and several from this group have moved more towards a Bayesian approach. And so it's really just a different statistical analysis where you look at the probability that one training method is better than the others. So training to momentary failure through a full range of motion versus volitional failure, where there's the lengthened partials that are continued after you can no longer complete a full rep. And so when we look at Bayesian statistics, it's not kind of this binary outcome that the frequentist approach tends to have, where it's reliant on a p-value, and we've been overly obsessed with the statistical significance set at 0.05, right? It's more of this probability of saying there's what percent chance, right, that partials were better for growth than training through a full range of motion. A good metaphor for this would be like the weather. You know, it's not whether or not it's going to rain or not. It's what's the probability that there's going to be rain. You know, um, and so
Mm-hmm.
we'll kind of go over some. We don't need to go too deep into that, but that's just kind of something that to highlight is the statistical analysis and how to interpret some of those values. I know that they also, I believe, did a repeated measures mixed effect model, and that handles inter-subject variability really well in the repeated measures. So with the within subject design of the study, where each subject basically acted as their own control in a sense, where one leg or calf was exposed to the full range of motion to momentary failure versus the other calf was the to volitional failure with the lengthened partials. So they went through the full range of motion training and then continued with the lengthened partials until they hit volitional failure. And so that's kind of an overview with the study design. Another thing that's important consideration is the participant population. So this was an untrained male population, and it lasted 10 weeks. Really, I think 12 is what they report, because there was the baseline testing, and then the 12th week was when they did the post assessments. And again, yeah, this was a within subject design. And so kind of with that within subject design is that also helps control for some of the genetic or maybe lifestyle variability um, that can be a confounding factor in some of the outcomes and stuff like that. So they measured the medial gastrocnemius, which they used B-mode ultrasound, which is a really common method for measuring muscle hypertrophy. And typically you can look at muscle thickness or muscle CSA, which is cross-sectional area. There are limitations to that, of course, as Dr. Cody Haun knows all too well. So I guess we can, that kind of highlights the method. So I guess we can talk about the results, right? So what did they find was doing lengthened partials beyond failure, did that result in a better hypertrophy outcome than doing the calf raises through a full range of motion to momentary failure? And so
Yeah.
I think that you have some useful or helpful visuals here.
Yeah. So this is from the research insight that we sent out in the letter from the lab. So a little plug there. It's free to subscribe, and we send these research insights that are effectively summaries of things that we've pulled out from studies that we're reading. And so Dan gave a good overview, but just to reiterate, 10-week study, 23 untrained men, average age of 32. And so they performed unilateral standing calf raises in a Smith machine twice per week for 10 weeks. And so each participant's right and left limb were randomly assigned to one of two conditions. So one condition, they stopped the calf raises at momentary failure in peak plantar flexion. So kind of think maximal shortened position, the top of a calf raise. That was one leg. The other one continued after achieving momentary failure in that shortened position. They continued with past failure partials in peak dorsiflexion. So the stretched position that on that other leg, they just did like a half rep after they achieved failure,
Mm-hmm.
in the shortened position. So within subject, legs were randomized, and that's kind of how it was designed. So before and after the 10 weeks, like Dan was saying, they did a B mode ultrasound of the gastrocnemius muscle to measure muscle thickness. And so this is just a visual aid to conceptualize the position of the foot and the ankle during each of those conditions. They did 10 to 20 reps per set. So in weeks 2 through 5, they completed 3 sets per session, so 6 weekly sets. They increased to 4 sets per session in weeks 6 through 10. So they
Mm-hmm.
went from 6 weekly sets to 8 weekly sets. And the range of motion was individualized based on each participant's ankle dorsiflexion and plantar flexion flexibility. So pretty good design here. And I guess this would be relevant to mention. So just zooming in a little bit, momentary failure for the plantar. So the full range of motion condition was defined as an inability to reach the same barbell height as the first rep. And then the past failure partials leg, they continued with partial repetitions until volitional failure in peak dorsiflexion. So they just lacked the ability to plantar flex from the deepest position. And the reps followed a 2-second eccentric, and then there was maximal intended velocity during the concentric phase. So this is just a bar chart. It doesn't have the errors, okay? But probably the most relevant finding is that the past failure partials, that leg, displayed an increase of effectively 10% in muscle thickness, while the standard failure, so the momentary failure leg that failed in the shortened position that did not do past failure partials, it only showed an increase of about 7%. So that's only a 3% difference, and we're talking about millimeter level changes here. Okay, so small
Right.
changes. The bar chart really helps to visualize, relative to each condition, but it's not like it was a massive increase in calf size. I don't want to oversell the findings, but there was, I
Mm-hmm.
think a meaningful difference here. So the way that they computed volume as sets times reps times load, of course, the past failure partials leg completed nearly double the total volume by definition. Now, if you add the distance component, if we looked at volume as work completed, then, technically it was less distance covered doing a half rep. So you could chop the volume down a little bit. In other words, full range of motion volume is different than partial, range of
Mm-hmm.
motion volume. You're not performing as much work, right? You're not covering as much distance, but uh, that's how it was computed. And yeah, I think those are really the main findings to point out. And then, there are multiple limitations. The participants were untrained, so might not translate as well to trained populations. First study on this. So, more research is needed to replicate the findings in trained populations and in females. I'd like to see it tested in other muscle groups, with different length tension relationships. A direct comparison between past failure partials and the initial partial range of motion would be interesting.
Mm-hmm.
And then, they reported increased discomfort, some of them. And so that's something to keep in mind. It lacked biochemical markers to explain the physiological mechanisms. They didn't include a non-training control group. Comparing one past failure partial set to drop sets or multiple traditional sets is another area that would be good to explore. So what if, the other leg, after a brief rest interval, for example, just matched the volume of the past
Right.
failure partials leg? Would we have actually seen that difference? And my hypothesis is probably not. So, but look, as far as a simple training method to incorporate, seems like something that I think is worth giving a shot, particularly on movements like a calf raise or a biceps curl, or even something like a triceps extension. I wouldn't advise doing it on like a bench press, barbell bench press, or like a deadlift. Not even really a squat, a back squat. Just think the risk of injury there is probably just isn't worth the squeeze. But if you're stable on a machine, and those variants I would feel better about. But more isolation based exercises like curls, calf raises, triceps extensions, lateral raises. I like to do those, over a leaning cable lateral raise. So like, go to failure full range of motion and then finish with some partials there in
Mm-hmm.
the lengthened position, when the humerus is adducted and the delta is stretched, the trap is stretched, and just do half reps.
Mm-hmm.
So what do you think, Dan?
So you're saying to not cat back the deadlift once I've hit momentary failure with excellent technique, that I shouldn't round and do lengthened partials.
I think the risk of injury to the spinal structures there, particularly those intervertebral discs, is probably not worth doing that when you could pick a safer movement and still get tension into the tissues,
Mm-hmm.
without a lot of thoracic and kind of lumbar flexion, sir. Yes.
All right. Well, I will not do that per your recommendation. I will
Uh,
say that, I think you had made a post on lengthened partials in the caps before, right? There was another study
yes, and leg extensions and
and leg extension.
or
Yeah,
knee
there's several.
extensions, and there's the one on hamstrings, so seated curls,
Mm-hmm.
seated leg curls versus prone leg
Yeah.
curls.
Cassiano, I think you made a post because I know that I started being more mindful of actually trying to stay in the stretch position and do more lengthened
Hmm.
partials with calf raises in particular. Um, and I have no data on this. other than a mirror. But it does seem like I feel like my calves have grown in the last several months of being intentional with that,
Hmm.
where emphasizing the stretch position, either doing a standing calf raise, or what I've really liked doing is a seated, like a leg press machine. And I actually got this from my girlfriend. Shout out to Whitney, because she always likes to do I call them calf presses on a leg press machine. So after she does leg presses, she'll knock out um, some calf presses on that.
Hmm.
And I really like that because it allows me to really load up the calves. And then there's a Nautilus machine at the rec here at Auburn University that is really nice for that. And just really emphasizing the stretch and not being concerned about hitting that full range of motion or that peak plantar flexion, but really just emphasizing the stretch, at least getting halfway, and just, yeah, I guess going to volitional failure with as heavy of a load as I can do. Trying to train somewhere within like 5 to 10 reps across most sets for that. And then one thing that I do like to do, to your point, you touched on it, is drop sets. It's a very time efficient way to train. So that's something that I've routinely been incorporating with my current training program, is a lot of drop sets. So I look to do like 2 to 3 really high quality sets, and then on that third set, either drop the weight 1 to 3 times. And I've been doing that with calves in particular. I like to do these on machines or cables, where it's easy to implement, it's safe, you're stable. But yeah, it definitely is an intriguing thought. Well, if you were to pair lengthened partials with all of the intensity techniques, right? Like maybe some rest pause and then you drop set it, right? It is kind of curious to think about what that could translate into for a hypertrophy outcome. And
Hmm.
then I think with the match training volume, I would agree that, yeah, I think if the total training volume had been closer between groups, it's unlikely that you would have seen a meaningful difference, if any, between the two conditions. Um, yeah, it's a 3% difference, and I think what they reported here from the mixed effects model was it was 0.62 millimeter increase or difference, with those credible intervals around 0.21 to 1 millimeters. So it's not a not a dramatic change, but there is evidence in favor of that. And I believe that the same first author in the same group, they have a preprint that was a follow-up question to this, and we can certainly do another talk on that after this. Um, is they looked at, I think this was a trained group of skim Reddit, and it is a preprint, but they had one group actually start in the stretch position and go to failure there, and then the other group, I think, did the full range of motion with the continued partials afterwards. And I think they actually found a notable difference in favor of starting in the stretch position. So curious,
Hmm. Yeah.
but I'll have to go and read that with a fine comb.
Yeah. So, and there, yeah, there almost certainly will be more insights to be gleaned from this area of research. But yeah, I mean, there's the manipulation of range of motion for a given exercise, and then there's exercise selection in and of itself. That's probably worth pointing out in this body of literature, where, for example, with that meow, I believe is how you say the name, but they've got, I think, 4 studies now um, in this area, and they looked at seated leg curls when the hip is in a more flexed position. So the at least the proximal portion of the hamstring would be more stretched when you are
Mm-hmm.
flexing the knee, right? And then
Yeah.
a lying leg curl when the hip is more extended, so the hip isn't in as much flexion, the hamstring isn't in as much of a stretched position at the beginning of the rep. And they found, the seated leg curls within subject resulted in that study, they used MRI, and it was about a 30% difference. I think it was only about 8 weeks.
Wow.
Um, so, that's another thing to keep in mind. And then they've looked at overhead tricep extensions or elbow extensions when the tricep is in more stretched position at the beginning of the rep versus with the arm to the side,
Mm-hmm.
and found the overhead cable tricep extension promoted some more growth in the triceps as compared to the humerus being basically in parallel with the torso, the elbow flexed at 90. And so yeah, I mean there's something there, I think, but it's not going to be a night and day difference. Of course, training with appropriate volumes and intensity is the name of the game. And for complete muscular development, uh, getting exposure across the full range of motion, including the peak contraction, is wise, to fully develop the muscle. But yeah, dude, as far as like a time efficient strategy, combining the past failure partials with a drop set technique, if you were really looking to shave off some time from the workout but still get a really good stimulus, that's something that we're already building into programming. We do like drop sets, but I've already been incorporating into
Mm-hmm.
programs these past failure partials, and so want to be careful with them though, because the muscle is stretched and you can pull a muscle. So we talked about being careful with exercise selection for this, but fatigue management probably goes without saying. Monitoring soreness, and if you are brutally sore after a bunch of past failure partials with drop sets for multiple days, and that interferes with your ability to accumulate more total forceful contractions or volume across the week, then that's a net negative potentially, right? So kind of just balancing the exposures across the week, and that's what we try to do with the programs in the app, right? And with clients, is just
Mm-hmm.
manage the stimulus. But yeah,
Yeah.
man.
Yeah. I think an important point is it's not for everybody. Right? I think it's a really small difference, at least within the time frame of these studies that have shown there to be a difference in the outcome for hypertrophy. Um, context is important. If you're looking to maximize muscle growth, it's definitely worth a shot to include. If it's something that's tolerable, because the discomfort is definitely greater with intensity techniques like lengthened partials, which they answer that with. In this current study, they had the subjects answer a questionnaire on that. Drop sets are uncomfortable. Um, so yeah, just who you implement that with is also important for
Mm-hmm.
sure.
Yeah.
Um, yeah, and then just kind of we can wrap it up here, but I think an important question is, would these results become more magnified, across a longer training cycle? So if this is if these are 8 to 10 week studies, and this study there's a 3% difference, would that difference continue to increase over a year, or would it become more similar? Right? And is there maybe some sort of a novelty effect, especially even if you have trained subjects? However, that's defined in you know each individual study, right? Is it could be a novelty where they
Mm-hmm.
maybe always do a tricep push down, right? And they
Mm-hmm.
don't do an overhead extension position, and they're trained. And then you have a bunch of people that this is a new, relatively new position for the tricep that then results in a greater change for hypertrophy because of the novelty of it. But then maybe across a year, you wouldn't really see much of a meaningful difference, or it might compound, right? It could be the flip side of that argument, where that 3% could just compound and it could result in a quite significant difference.
Yeah, it would be interesting to see like a year.
Uh-huh.
So there's an idea. If we could get some money to do that study, that would be cool. But
Oh
yeah,
yeah, for
a
sure.
longer term study on this, yeah, would be helpful.
Definitely. Well, I think that that's it for this talk. There'll definitely be more on the way. Thank you for listening, and peace.
Peace.